Okay, so let's talk a little bit about how fluids circulate through the lymphatic system. Okay, so in this image, what you're seeing here, you've got your arterial, you've got your venule, and then you've got this capillary bed in between. And as we talked about in our last chapter with blood vessels, some of the fluid will go into this interstitial space from the capillaries, and some of that will be picked up by your lymphatic system. Now, unlike the circulatory system, the lymphatic system is not closed, meaning it has these dead end sort of branches, right? They just stop. So these branches basically can be found in between these cells. Again, they're picking up any of that interstitial fluid, and the flow of this lymph will be moving depending on where in the body it is. But it's going to either move up or down or over, but basically it's moving back toward the heart, and we'll see in a moment where it is emptied. Let me just quickly here. Lymphatic vessels do have valves in them similar to veins, preventing backflow of this fluid. Pretty much you'll find a lymphatic capillary everywhere you will find a blood vessel, so anywhere that is avascular, meaning no blood vessels, except there you will find a lymphatic capillary. They do have a specialized structure, these little sort of thin lines you see in this image. Those are called anchoring filaments. They keep them open so that they don't collapse under the pressure of the interstitial fluid. And the cells sort of overlap like shingles on a roof. So if there's so much fluid in here that it wants to flow back out, it kind of functions as a valve and closes. So fluid can only go in one direction, into the capillary, into the lymphatic capillary, and not back out. So as I mentioned, the fluid all flows back in one direction, so it will go from these lymphatic capillaries. There's always these checkpoints of lymph nodes, and these larger lymphatic vessels, and all of this will take fluid back up to that subclavian vein on either side, which will then return the fluid back toward the heart. The flow is basically the same as we saw with blood in veins, so it's either the skeletal muscle pump, and that's considered milking action, kind of as it's pumping up. You're kind of mushing it up. I say mushing, it's not the best way, but pressing it back up toward the heart, as well as the respiratory pump that we discussed when we talked about veins and blood vessels. Now there is something called chyle. It is basically the same thing as lymph. The only difference is that this is going to come from your intestines, and because it's coming from the intestines, specifically the small intestines, there's a lot of fat in this. So instead of having this very clear, pale yellow color, it's going to have a creamy white color. And because it doesn't look exactly the same, because it has a much higher fat concentration, they give it a different name. They call it chyle. But otherwise, it's basically the same thing. So it's simply lymph that is returning from the small intestines that has a higher fat content and therefore a milky white appearance. We have 5 major lymph trunks. These will supply the various regions of the body. There are the lumbar trunks that are receiving lymph from the lower limbs, intestinal one that's receiving it from the digestive organs, something called the bronchomediastinal trunk, if you remember that mediastinum. So that's collecting lymph from the thoracic cavity and the thoracic viscera, or the organs of the thoracic cavity, in other words, heart, lungs. The subclavian trunks are receiving lymph from the upper limbs and the walls of the thoracic cavity, and then the jugular trunks are draining it from the head and the neck. And again, you can kind of see where everything is bringing it all back to right here, where that subclavian and jugular veins connect and form that brachiocephalic vein on either side. Okay, so what can go wrong? We may have heard of Hodgkin's and non-Hodgkin's lymphoma. Both are cancers of the lymphatic system. The cells are growing out of control, causing swollen lymph nodes and growth throughout the body. There's multiple types of each lymphoma. It just depends on the characteristics of the cells and their behavior. You have to have this special type of cell called a Reed-Sternberg cell for it to get the classification of Hodgkin's lymphoma. If that is not present, it's classified as non-Hodgkin's. Okay, so you don't need to memorize this chart. I'm just letting you know the differences just for your awareness between Hodgkin's and non-Hodgkin's. Non-Hodgkin's is fairly common, whereas the Hodgkin's variant is pretty rare. More than 86% of patients diagnosed with Hodgkin's lymphoma survive 5 or more years, so it's got a pretty good survival rate. Actually, both of them do compared to other types of cancers. Again, you don't need to know all this information, but just be aware there's many varieties of Hodgkin's and non-Hodgkin's. There's clearly a lot more types of non-Hodgkin's lymphoma. Okay, it's more for your information, really. And then there's something called lymphatic filariasis. The old name for that was elephantiasis. Basically, the parasites are transmitted and they destroy the lymphatic capillaries in a body region. This picture of this woman here is one of the earliest known pictures of someone who has this disease, and you'll notice how different her legs look compared to like the upper part of her body. This is because the lymphatic capillaries in her lower limbs have been destroyed, and because of that, all that excess fluid that can't return into the blood vessels stays in the interstitial space, causing massive edema, massive swelling, damage to the tissue. Secondary infections can also occur. So you can see the same thing in this man. In his case, it's not his entire leg, but just the lower portion of his leg, where the lymphatic capillaries have been destroyed. It's fairly easy to treat. You just have to kill off the mosquito, like the larva, so it's easy to treat. It's just a matter of having access to that treatment. And you can watch a couple of video links for you to learn a little bit more about that. Okay, and that's it for this section. As always, please let me know if you have any questions.